Thank you. And I'll start by saying good afternoon to everybody and a warm welcome to cabinet members, or member at the moment, I think. And I'm sure Dave is going to join us and other officers to this joint meeting of Child and Family Services and other social services scrutiny panels. As we have said previously, I guess, currently we are trying to ensure that we carry out some effective scrutiny whilst minimising officer time in preparing for meetings, I guess. Our last meeting was also a joint one and was held when the current large spike of infections was taken off and causing major concerns as social services and the National Health Service, of course, locally could be overwhelmed. Currently, I'm sure that everybody will be a bit relieved to see that the Swansea infection rate is reducing, and according to the Evening Post today, is down to 148.6 per 100,000. I think that's the right figure, Clive, isn't it?
It was a bit higher than I thought. It was still around the 160 mark, but you might be right.
Okay. However, there's still a lot of huge pressure on National Health Service and our Social Services Department, and also the National Health Service is now having to cope with rolling out the vaccine as well. I'm pleased to say that, but I'm not going to say any more on that at this point in time. Okay, if I can move on to the item onto the agenda, then item 1 on the agenda is apologies for absence, and I think we've had a couple, Liz.
Yes, we've received apologies from Mike Dirk and Erica Kirshner. Okay,
thank you. And item 3 is item 2 is a disclosure of personal and prejudicial interests.
Paxton, sorry, can I just do the roll call?
Oh, sorry, you want to do the roll call. Sorry, Liz.
Okay, thank you.
Write that down. Okay.
Mandy Evans. Oh, yeah, I can see she's here. Joe Hale.
Yeah, Liz.
Okay. Joe Hale, no. Chris Holly.
Yeah.
Paxton Hood-Williams.
Yes.
Yvonne Jardine. Jeff Jones.
Yeah. I'm here.
Susan Jones.
Yes.
Hazel Morris. She was. Okay. Gloria Tanner. Cyril Anderson.
Yes.
Mike Day.
Yes.
Kevin Griffiths. Wendy Lewis.
Yeah.
Des Thomas.
Present.
Tony Bedu. Yeah, I know he's here. Clive Lloyd.
Present.
Elliot King.
Yes, I'm here.
Dave House.
Yes.
Okay, thank you very much.
Okay, thank you. On that basis, now then, perhaps I should have said a welcome to Tony Bedo as well, though he's been able to join us again, so we're glad to see you back, Tony. Item 2, disclosure of personal prejudicial interests. Could you put your hand up if you want to make such a disclosure, please? Okay, I'm not seeing any hands up.
Chris
Hands up.
Holly's got his hand up.
Oh, sorry. That's better. Chris. Sorry, Chris.
I just had to declare my daughter works for social services and it's been to I've got dispensation.
Thank you. Anybody else? I'll try again now. In item 3, prohibition of whip votes and declaration of party whips. Item 4, I guess, is that the minutes of the previous meeting, you will all have had the opportunity to see the minutes of the last meeting. So unless anybody has a point to raise, would somebody propose they be accepted, please?
I propose.
Thank you, Sue. Item 5 is public questions, and I don't think we've had any. And item 6 is performance monitoring. Just for members' benefit from previously circulated data, various points were raised and the director was asked to address some points. So Dave, if I may, it's over to you.
I think the cabinet members wanted to make some points first of all, if that's okay, Chair.
Yes, of course. Sorry, Clive or Elliot.
Yeah, go on. I'll kick off then. Listen, I suppose some of this is going to merge into the other item as well, Chair, potentially. But yeah,
Okay.
I'll just make some opening comments because the performance monitoring is an important aspect and the role of scrutiny. That you know, there are other things that need to be managed, other indicators that do need to be managed, and I know that Dave and his team are doing that through PNFMs and day-to-day management. So I know that is an important part which you might want to touch on. But coming back to your opening comments about our last meeting, I suppose is where I just want to kick off. Yeah, we painted a really big picture, didn't we, about the infection rates. You were right, Paxton. Apologies. There's 145 today in terms of infection rates per 100,000 in Swansea with a 12% positivity rate, and that has been a steady decline over Christmas. I was reflecting on the position around the time that we last met, and we were up to 700 plus, 770, I think it was the infection rate at that time per 100,000. So a significant reduction. We reminded, or we told you some of the things that we were looking to put in place to deal with some of the anticipated surges that we were expecting to cope with over the Christmas period and post-Christmas period, and those were around putting in place a rapid response team, getting Parkway as a facility, as a potential facility to use. We'd already put in place a social work restructure, but we were also looking, unfortunately, at reducing some of the services around day services, respite, and indeed around some of the domiciliary care to some of those, and asking a big ask of some of the families yet again about taking on some of that responsibility. What I would say is, and again, Dave will come in and back some of this up, but as a narrative, what I would say is that Christmas was really difficult. The first couple of weeks were really difficult as well. So we saw a situation where the rapid response team that we put in place with our health board colleagues around having to go into particular care homes that are under workforce pressures particularly, we saw that being deployed on a number of occasions over the period. I suppose what I would say is that, you know, that we didn't see any of our care homes fall into a situation where, you know, we had to transfer people out of those care homes. They didn't become overrun, I suppose, and in that respect. So, you know, huge amount of credit must go to the staff over this period. Again, you know, in terms of the commitment, the ask that we made of them in terms of ensuring that we maintained a service to some of our most vulnerable residents, whether that be in care homes or in domiciliary care. But I have to say that whilst the narrative around the reduction in infection rates is really, really welcome, we're not seeing that relayed into some of the pressures in terms of certainly our social care services. And I know that's reflected particularly in health and ICU, the ICU service and pressures that they're being undertaken. In fact, I would say that my discussions with Dave through last week were as bad in terms of the pressures that we were under at any time during this pandemic. And that would be reflective in some of the outbreaks that we've had in our care homes, but also, again, on our capacity of our workforce to continue to be on the front line at a time when they themselves were either having infections or being asked to isolate, or having the usual amounts of pressures, normal sickness pressures that they would have anyway in this, this demanding role. So, our care homes continue to be under pressures. I think last week, Dave, we had at least within the region, we had 8 care homes that were in that sort of red area, high risk category again, which we were having to monitor and ask for assistance to be placed into. And again, that places, like I said, a huge amount of pressure on everyone within the service. So unfortunately, unless Dave tells me anything different today, those pressures are not being reflective in the reduced infection rates that we are seeing. So we've got a bit of time to go yet before we can see any sort of light at the end of the tunnel, any sort of thinking of lifting the restrictions, in my view, anyway. And we've got a bit of time to go through the next couple of months in dealing with this pandemic. That's not to say that the infection rates reductions is not welcome. On top of that, we're vaccinating large parts of our care home sector, large parts of our social care, domiciliary care workforce, and of course we have a bigger ask of people in terms of some of the contacts that we might have had under normal times will start to come through at our front end as well. So there's going to be pressures in different parts of the social care system that are probably on hold at the moment, but at some point are going to come through, and we're going to have to deal with those pressures as well. So we've got a bit of time to go through this pandemic yet. And as I say, the focus through Dave and his team has been very much on making sure that we're dealing with these pressures, being mindful of the ask that we're making of people within our communities, the ask that some of our carers, our unpaid carers particularly, are being asked to undertake some of the tasks that they've been asked to undertake during this period. All that still needs to be managed on a day-to-day basis. So, as I say, Chair, apologies, I probably covered a bit of performance monitoring, a bit of COVID response, but from a political perspective, I just wanted to summarise where I think we're at. Great that we've got reductions in infection rates. Great that we've got the vaccine programme now really ramping up. I think in Wales generally now we've overtaken Scotland and Northern Ireland in the numbers of vaccines that we're giving out, but we're still under huge pressure, and those sorts of things have not transposed themselves into some of the pressures on adults and child and family social care at the moment.
Thank you, Clive. I think really when I said obviously it's good to see infection rates falling in Swansea, obviously understanding that at this time there's still huge pressure within the health service and also within social services, but hopefully it is a glimmer of hope as far as both of those are concerned in terms of going forward. And I think that's the point I was hoping to make at that point in time. I didn't stress that enough, that it is just a glimmer at this point.
Yeah, no, I
wasn't trying to imply that the pressure's got away.
No, not at all. And listen, you've got to have hope, haven't you? Otherwise, you've got to have some hope, and it's good that those things are happening, and hopefully they will transpose themselves into a sort of a little bit of an easing of those pressures in time.
Okay. David, do you want to come in at this point, or does Elliot want to say something first of all?
Just check with Elliot. Did you want to say anything now, Elliot? Do you want to wait until after I've spoken?
Well, I could just say a couple of brief things, just to add on with child and family context, I suppose. And the main things there you'll see in the report are really around how resilient the service is and how it's coping. And that's a very positive sign. And I suppose the key measure of that is activity around the front door, which is being managed very well at the moment. And then that's balancing both the demand that we have and also, staff absence, etc., making sure that all works and is balanced quite well. You'll see referenced in the performance report the work that's been ongoing with the early help hubs, but also with education settings around making sure that those conversations are happening around, the safeguarding and the what matters conversations, as it's referred to. And obviously schools and the service still have the RAG rating to check up on those those young people with their concerns, and that's even more important, isn't it, at the moment when schools are not actually when most children are at home at the moment. So that's really important to keep an eye on that. And you also see referenced in the report, I think it was picked up in the last meeting around the assessments, and it's great to see that has much improved now. So there's continued work on that. The other thing I suppose slightly of concern is that the child protection register, the numbers are slightly up there, and you'll see that referenced. And there's a bit of work going on to see what the reason for that might be. Whether it's whether there are issues or whether it's related to working practice. But I think it'll be important to see what the reason for that is. That's probably all I wanted to pick out at the moment. Thank you.
Okay, thank you, Elliot. Now then, David.
Yeah, great. Thanks, thanks both the cabinet members, and thank you, Chair. Yeah, I'll build a bit on what both the cabinet members have introduced already, and then I'll make sure that I cover all the specific questions that members of the committee have helpfully alerted me to in advance. Just to pick up on, what Clive has touched upon there. Thank goodness we were talking last time about the reality of, certainly for our region and our local area, we absolutely believe that there needed to be further societal control measures put in place. The trajectory we were on pre-Christmas with not only very high rates but escalating rates in terms of infection, and also the positivity rate that was that was increasing all the time, i.e. the rate at which proportion of people that you test turn out to be positive. At that time we were perhaps between 10 and 20 times higher in terms of infection rates than the levels at which the World Health Organization would say you need to be putting control measures in place, and in terms of positivity rates, something like 500% higher than the level at which those control measures we put, and they were increasing. So what we were planning for necessarily was, in the absence of those control measures, difficult to imagine what sort of problems we would have experienced over Christmas and into the new year. We were absolutely strongly advocating for control measures to be put in place, and still in those circumstances expecting severe pressures both on the health service and on communities, on our community health and social care services. Control measures were put in place. As you've already identified, the infection rates and positivity rates have started to reduce, as we would expect. But I suppose the tail of having those very high rates for a significant period of time has then played through the system over the Christmas period into the new year. We're still experiencing them now. And even though those rates are much reduced, if you think about what a rate of 150 per 100,000, well, that's still 3 times higher than the World Health Organization would recommend that you need to put control measures in place to bring infection under control. Positivity rate is still more than double what at the moment, but hopefully on a continued downward trajectory, as long as cabinet members said, those control measures at a societal level stay in place. So we're far from being out of the woods in terms of the impact of that on our population and on our most critical services. Just to remind you, I know you know this, but it's worth repeating the way those things play through the system. So what happens when you have increased infection rates? Generally, that works its way up through the population into, from younger age groups up into the older age groups. It's once it hits the older age groups, and for those people with, clinical vulnerabilities, that's when we see, higher rates of hospital admission. And sadly, that's when we say, even with all of the increases in, medical interventions, all of the stuff that, has progressed fantastically over the past year, it's still associated with increasing, numbers of deaths. And that's what we're seeing play throughout Wales and including in our region. Probably how I would judge that is that we were slightly ahead in our region in that second wave that's played out through Wales. Hence the urgency of all the measures that we were, alerting you and Welsh Government to, pre-Christmas. It has been an extraordinarily difficult time, as Cabinet members have said. Our staff have been magnificent, but, this is 9-10 months into, we have not had a break. We're first wave, as we've talked about, all of the astonishing things, really. Our workforce in the council, in the independent sector, in the third sector, members of the community, the unpaid carers, families, etc. When we got to the summer and we saw the first wave decreasing, that didn't cause a let up, as we talked last time, in terms of our services, health care, and the impacts on those families, carers, and individuals receiving care and support. The reality was we spent the summer and into the early autumn dealing with the repercussions of that first wave, and the fact that the members of our community had been so impacted by the cessation or the significant adjustment of services. So that, as we talked last time about the complexity of their needs and the responsibility on us as best we can to try and support the recovery of those and rehabilitation of those individuals, meant that we were continuing to work at full pace. Then we had second wave and needed to reintroduce all of the measures that we had in place first time round, all of the lessons we learnt from that first wave, and ask our workforce across all of those settings to go again. As Cabinet members have said, they have risen to that challenge magnificently. They are exhausted, and we're still in it. We are still at this point in time, I suppose, dealing with a combination of both. The further repercussions of services, health and care services having been severely restricted, therefore complexity of individuals' needs, increasing, across the board, trying to respond to that whilst we have all the limitations still on our, on our ability to deliver services in the way that we would like, and all the restrictions on our workforce. We still have significant numbers of staff periodically directly impact either by COVID, by having to isolate, by the stresses and strains of that long period of time at which they have been working at beyond 100% pace, frankly, plus all the usual stuff around winter and the pressures that emerge from that. Plus, of course, these are members of our community as well. These need to pick up on their caring responsibilities because schools are shut, or because members of their families aren't able to access services and support in the way they usually would. Therefore, they're stepping in and supporting that. When you put all of that together, it remains absolutely extraordinary that we have kept being able to keep things going, despite those challenges. So, as I said last time, we can't say often enough, how in awe we are, and our commendation of that workforce across the piece in terms of keep stepping up. It does, as Cabinet members have said, it feels like a bit of a paradoxical position that we're in. We can see infection rates coming down, but they are still far too high. Yet it does feel like, putting all of those things together, that January, as we anticipated, is the hardest month that we've experienced, to date. It remains a position, in some of our critical areas, it still remains extremely fragile, particularly care homes. Clive updated on the position as of last week. It remains the same position this week. We have a number of homes that are at high level of risk, so needing additional support, and then a smaller number of homes at critical risk, where we're practically having to, between us and health colleagues, be in those care homes, supporting that staffing group and supporting those residents, pretty much 24 hours a day for a period of time until we can stabilise them, on top of running our own services. We remain particularly impacted around domiciliary care, where clearly we're trying to strike that balance between asking families and informal carers to do more, but also stretch our resources to provide for individuals with most critical needs as best we can, whilst our workforce is again depleted in that area. It's an extremely challenging position, yet, touch wood, there hasn't been any critical failures, absolute critical failures. It's far from that. I don't want that to be interpreted as, this is we're running business as usual, that this is perfect service, that we're not getting, legitimate challenges from individuals about, their circumstances are too difficult and we're not, helping enough. Of course, we're getting those challenges on a daily basis, because we wouldn't want to be in the circumstances we're in and have such, necessary restrictions on, capacity and our ability to respond to demand. It's a COVID response that we're providing. It's a magnificent response that our workforce are providing, but it's far from ideal, and it does mean that there is a considerable ask on, individuals in our communities, who rely on care and support, and particularly, carers and family members who are asking such a lot. And when I talk about people being exhausted, they are as exhausted as our workforce. Cabinet members talked about, and you have, Chair, about hope, and of course there's hope with infection rates coming down, and hopefully that trajectory continuing, and with the rollout of the vaccination programme and the prioritisation of those members of our community that are most vulnerable to the most severe consequences of catching COVID, and then the frontline workforce that directly provides health and care to that most vulnerable group. Clearly that will have an impact over time, but it's going to take time. The target at the moment in our region is to vaccinate all of those individuals, whether members of the community or staff that fit the top 4 categories of the JCVI priority list by the middle of February. That's a really challenging timetable, but as things stand at the moment, we have sufficient supply of vaccine to hit the numbers that we need to vaccinate to get all those cohorts covered, and the infrastructure around that sharing out of responsibilities amongst GPs, primary care, the use of mass vaccination centres, etc., which will further gather pace and with what we expect in terms of increased vaccine supply over the next couple of weeks, we expect to hit that target by February. Clearly, it's the health board that are at the centre of rolling out that programme, but the councils and our partners through the RPB arrangements are supporting that. With logistical support and making sure we're feeding through the information around who are all these social care staff, because they're clearly not all employed by the council, and then having the local contacts with care homes, etc., to make sure that if there is any glitch, we're able to feed through that information and support the health board, to remedy where something isn't working perhaps as well as planned. Like anything, it's a massive programme. Like anything that I would describe, it'd be disingenuous to say, that it runs perfectly, that it runs like clockwork. But I've been enormously impressed at the efforts of the health board working with partners, to make that a reality and give us a, really high probability that we'll hit that first target by the, middle of February. Don't claim it will be perfect, but I think we're well on track to get in there or thereabouts, and that's to the credit of all those staff that have been involved in that programme. And as the cabinet member again has said, that means that there's those staff who are being taken away from their usual job to support the vaccination effort, whilst trying to then compensate for, well, then we've got gaps elsewhere and we need to mitigate those gaps as well. I'll probably turn to some of the specifics in terms of questions you've asked, rather than go into the details of other, because it touches on some of those other service areas that I just want to update you on. So let me just find the questions to remind myself of them. Okay, so you've asked, quite rightly, you asked some questions about emergency respite and day support. So you asked a question about capacity, and the logistics of delivering that. So in normal times, we'd be offering, our traditional day service offer to about 600 individuals at any given time. When we remodeled it to, we couldn't offer that, that traditional offer in the same way, both because of staffing capacity, social distancing, infection control arrangements. In lots of areas, including ours, the initial response was, we're just going to have to stop these services. And then we remodeled them to, look, we've got to be able to provide something. Different areas have done different things across Wales, but our approach has been to say, we will remodel those services to have an emergency respite offer for the most challenging circumstances, where our other offers to support people at home just aren't going to be good enough to keep those individuals going, keep the caring arrangements in place, and keep those individuals safe and well. At some points during the during the past year, we've probably managed to get enough emergency respite in place to offer about a quarter of that capacity. So that was probably about the extent. Might have been some variability, but about the maximum extent to which we were able to use that remodeled support to support that cohort. 100% take up of that from whatever capacity we have. There's enough demand for that for us to make sure we're always using it. As we approach Christmas and that really difficult period, we weren't managing to keep to that capacity, and at one point, just to keep things going elsewhere, we needed to stop that altogether for a short period. And then into January, we've been stepping that back up again. And as things stand this week, we're probably at about something like a fifth of the usual. So if that's 600, We're probably this week at offering support to about 120 people via that route, but we've still got some way to go with getting back up to. I think we'll get back up to about a quarter of the usual numbers that we would be supporting, again in fairly short order. It is a challenge, but there's a bit more scope to do that. That doesn't mean that people who have been traditionally offered support don't get any support at all. So it's, we still, as an absolute minimum, would be staying in touch with those individuals, and some of those individuals will have been getting a different but and quite limited level of support at home periodically as well to mitigate for that. Some individuals have said, no, we're still able to take care of this ourselves, and actually we don't particularly want to be accessing support outside the home given the levels of community infection rate. So overall, that's pretty good. And if I look across Wales and compare that with what others have been able to deliver, the position in Swansea is a very good one, and both the cabinet member and I, whilst we get challenges about we expect things to be like they used to be. Of course we get those challenges. We also get a good level of feedback that's really positive for those individuals that are able to access this support, telling us how good it is, and also how appreciative members of the community are that we've been able to offer something, albeit a more limited service than we usually would. You also asked about, quite rightly, about what's happening with performance around annual reviews. There's variability in that performance, and also well below what our targets would be. Well, I think as I flagged last time, in our prioritisation of our work and being realistic about what we could cope with and what we couldn't cope with, and to make sure we prioritise doing what matters most, we made a decision that we will step down planned reviews where individual circumstances were capable of us stepping down reviews, given that we're constantly in contact with people around whether they're really difficult circumstances continue to be manageable, or do we need to step in with something different. So our planned review work is extremely limited at the moment. Frankly, when I look at the performance on reviews, I'm surprised they're as high as they are, so because we have actively deprioritized some of that work. I'm really impressed actually that our colleagues in mental health services, and that's between our own staff and health board colleagues, that they have managed review performance at such a high level. And I think that probably reflects that they're using those reviews to recognise the fact that we know there's been a big impact on people's mental health as a result of the pandemic. So they're using that review process, I suspect with some limitations on what it would usually look like, to capture some of that. Well, what are we doing to offer what support we can? And again, it's restricted, and and demand has changed in the reason that I've said. But I'm impressed by that. In terms of reviews around older people, we have restructured the adult services teams, and there is a specific team now that includes responsibility for the annual review function. But at the moment, we're not able to prioritise doing all of those reviews. So again, we've concentrated on doing the most, responding to the most significant challenges people have had. In learning disability services, it literally is, well, our workforce is depleted. We haven't made any structural changes to the learning disability service. Services for people with learning disabilities, and a lot of that would have been the restricted day service offer, clearly has been clearly has been severely impacted. So the reality of that performance is it reflects that those demands exceed our capacity to respond to those demands. And that's one of the areas where we've said, well, we're going to have to park some of that work for the time being, but have alerted everybody, carers, individuals, people living in, supported accommodation, type arrangements. Look, even though there isn't, formal reviews necessarily taking place, we will be contacting you at least on on a weekly or a fortnightly basis to check in, and you need to alert us to any deterioration in circumstances and care arrangements that require us to step in and more. You asked an overall question about, well, how do we plan to improve things? Well, at the moment, I don't plan to improve things during this second wave of the pandemic. We are concentrating on making sure we can just keep our arrangements going during the second wave, and hopefully avoiding a third wave. We have committed to recruiting extra resources and have been. We have rolling ads out all of the time. We're taking all sorts of steps to encourage colleagues from the third sector to come in and help. We're constantly asking colleagues across the council if they're available to step in and help, as well as our formal recruitment across the board. And what we're committed to doing is we will keep the additional capacity that we are recruiting in order to respond to the emergency at the moment for a period beyond the emergency in order to catch up on our work. And that review work will be caught up by maintaining that additional resource beyond whenever we're somewhere out of the current crisis. You asked as well, quite rightly, about carers.
Can I give you a rest there a minute, David?
Of course you can. Yeah, sorry, I wasn't monitoring hands.
I know Chris has got a question for you. Chris? You're muted, Chris.
My apologies, I missed it. Mike, when we met in the Scrutiny finance and performance meeting a fortnight ago, I met with Richard Rowlands, and we had a discussion about performance monitoring and performance generally and reporting on performance. The problem is we're in a unique situation as it is now. And as much as I think you said about your admiration for people in the mental health sector with their performance, we feel, and I don't know how other members of the panel feel, but I feel that the performance is actually, we are seeing a performance being done by the people the way they work in now. And I think if there's anything that we can say that can lessen the load on actually reporting performance until this pandemic is over, I think that's what we should do. I think it's far more important that your staff concentrate on work in hand and that we concentrate on performance later on, because I think the actual work on the floor on the ground is far more important than the registration of performance data.
Can I come in on that for a minute, please, if I may? And I'll come back to you after Tony. Just to say that I think, David, it's fair to say that you were very keen that we carry on doing a certain level of scrutiny, and in terms of performance monitoring, and that's why we've done it, Chris, I have to say, because we were quite happy to say at this point in time, because of the pressures on the department, and particularly on management in terms of producing reports ready for scrutiny, that we were quite happy to reduce significantly the amount of scrutiny that was taking place. But I think, David, you specifically asked us to carry on doing a certain amount of it because that's what you think is right, that we should do it. I know Sue and I have agreed wherever possible we will reduce the load by having joint meetings, but that's the situation we're in. And basically, I agree with what you say in many ways, Chris, don't get me wrong, but I think it was Dave who was asking specifically that we do carry on to a certain degree with performance monitoring. Before you come back, David, can I bring Tony in?
Is that okay, Chair?
Yes.
Thank you, Chair. the thing that struck me when reading through the minutes of the last meeting and listening to today's presentation, and by the way, I'd like to add my congratulations to the work that's been done. And having been in the front end in my time in the past in terms of bomb attacks in Birmingham and major incidents and so on, I've probably got some little bit of insight into the pressures that everybody's under. But the thing that struck me, Dave, is that in the second bullet point of the last discussion points notes, we talk about creating a mobile team effectively to underpin our external care providers. That's a new departure, and to me suggests a change in the relationship that we may or may not want to continue. I don't know if you can give me some idea as to how many people were involved in that, what the size of the commitment was, either now or later. But the second thing is, in the performance report, you refer to the changes, the good changes that have arisen from the work of the rapid discharge team. And again, it seems that there's been an improvement, a change in the relationship between social care and health, which again is to be welcomed. And then the third bit is in terms of your reference to what I fear is going to be a long supporting programme to assist the staff in both organisations who've gone through hell. That's another potential change in relationships between social care, local government and the health service. And I just, I've taken the last one. I mean, I think if the support packages for COVID can be jointly negotiated, jointly delivered, with staff from both organisations coming together to share their experiences, that'll be a further change, a further development, positive development in relationships. So as part of the review process, or in some senses the forecasting process, I mean, it has this pandemic really altered fundamentally and for a long time some of the traditional relationships, A, between health and local government, and B, between the public sector and the private sector.
Yeah, Chair, I'll come back on both the points, and yeah, absolutely. The point that you've made, Chris, is well made, and yes, we absolutely need the council and scrutiny committee to be mindful of additional and avoidable demands on the service. One of the reasons that I'm here rather than the heads of service is, to avoid the need for the head service to come here. They're right in the midst of managing all of this, obviously every day, and every hour of the day, frankly. I suppose it is about finding a balance. Mostly I would want scrutiny to concentrate on, well, make sure that you are keeping abreast of how we as a council are responding, and dealing with the impact of COVID, the changes that we're making to the, to services, etc. And any performance monitoring, as best we can, restrict the performance monitoring to how is COVID impacting and how are we mitigating that as best we can. I know the cabinet members and I really appreciate the fact that you, are limiting and focusing scrutiny on that really important areas. But I do think it's important for the council to maintain that scrutiny function, whilst things are so difficult. I suppose, last time you submitted a list of questions, and I didn't necessarily, refer specifically to the questions. We gave you a more general update. I think the questions that you've submitted, I can certainly see where, they are linked to a COVID impact. And I suppose I'm responding to them not to try and, paint a picture that says, performance hasn't been severely impacted. Of course it has. I'm trying to answer in terms of, yeah, it has been impacted. This is how it relates to COVID. This is what we're doing to try and mitigate it. But we can't hit all of our targets. That would be absolutely ridiculous. It's finding a balance really between, keeping the focus of scrutiny on, how is COVID impacting on our services, on our population? What are we doing to mitigate that? Is there anything that we, need to think about, doing differently, more if there's insights? But that critical challenge function that scrutiny has always provided remains just as important now as it does pre-COVID and post-COVID from my perspective. I can see Clive's got his hand up.
Yes. Clive?
Yeah, just on that point, no, I would agree. It is a balance, isn't it? And again, I'd like to reiterate, the point that Dave made, and thank the panel for making this a joint scrutiny panel. I don't know what the arrangements were before, but that's certainly helpful. But we have to, I think as a Dave's management team have to have a minimum amount of key performance indicators that they have to keep an eye on, because not least because at some point we have to be mindful of what's not coming through during this pandemic as well. What's being stored up for the future when people who are feeling that we don't want to ring social care at the moment, we don't want to ring the front end in child and family. At what point do they start ringing? So we have to be mindful of some of these key performance indicators and keep an eye on them at the very least and challenge them. And I think that's where, there's still a bit of a role to keep us, keep us mindful of that. There's parts of our community that are decided not to contact us, but at some point coming forward, they will, and we're going to have to deal with that at some point as well. So I think it's worth being mindful of that. But I think, we're getting the balance right. I know for a fact that Dave's PNFM now, instead of lasting 6 hours, only lasts 4.5 hours. So, we are mindful that we are focusing on the right things. But no, joking apart, it is about a balance.
Okay,
thanks, Clive. I'll come back on Tony's points. Yeah, absolutely. Well made points, Tony. It has. I think this period has been, in my experience, the most effective period where our health board, working with both the local authorities and our other partners in the third sector, it's been the most effective it has ever been, and has worked at extraordinary pace to respond collaboratively. And you're right to say that some of the developments that have emerged from that, almost the proving that it doesn't need to take us 6 months or a year or 5 years to make a change. Actually, we can make a change for the benefit of our patients and our citizens in about 3 days, if we're absolutely committed to doing what matters most with a relentless focus on what makes a difference to individuals, not what's convenient to the organisations, albeit having to be mindful of, these place huge demands on our collective workforce. But I'll pick up on the example of the care home support team, because it has been held up around Wales as an absolute model of best practice. We got to, with, 3 weeks out from Christmas, absolutely thinking, there is a real risk that 1, 2, 3, 4, 5 care homes might all fall over. Where are those residents going to go? They're going to end up, front door of hospital, or we're going to be trying to move them to other care homes with all the incumbent risks around spreading infection further and all of those sorts of difficulties. And we set out, it was literally the beginning of a week, beginning of 1 week, we said, we need a workforce somehow across both local authorities and the health board, both mental health services and primary and community services, that we can say on any given day, we have staff available to step in wherever, and that's step into the independent sector, come in and help with, in council care homes, and, Swansea staff responding to homes in Neath Talbot, health staff stepping into a residential care home when usually they'd be supporting a nursing home, and set ourselves the challenge of, we got to have that team up and running by the end of the week. Now, we didn't get it up and running by the end of the week. It took about a fortnight, and it's still running. And our target was to have it, up and running and available to support care home sector until the end of January. And now we've had to extend it because we're nowhere near where we need to be. So we're at least saying it needs to be up and running by the end of February. Clearly, when we say establish a care home support team, the reality is it's staff who already work in health and care services. This is on top of their day, their day job essentially, that we're asking, to put themselves forward, to be on the list of names that we can call upon. And as Clive has already said, the reality is we've used it every day since, a bit of it, but to different levels. We hoped that we would have, I don't know, the ambition was, can we find enough resilience that if we had to prop up 15 homes on a given day, would we have enough resource to do that? And we haven't got enough resource to do that. If 15 homes fell over today, that would be cataclysmic for us. But we have had days, continue to have days where, 4 or 5 homes have been in real difficulties, and we've been able, to date, so far, touch wood, we've always managed to respond through those mechanisms, and everybody knows who to contact. So if it's Gold Command on a Friday night in the health board, getting a call saying we got a real problem in this place, our district nursing or our acute clinical nursing team are overstretched, we've run out of resource, they know, that Gold Commander knows who to ring in the 2 local authorities to mobilise that resource, from wherever it is, to go in and support that home. It's not perfect, but it's pretty damn close to being bloody brilliant from my perspective. It didn't exist 4 weeks before Christmas. It existed by the time we got a week before Christmas. It don't exist anywhere else that I'm aware of, and it's recognised as as a model of good practice. And when we think about what our services might look like post-pandemic, I think you're right if that's what you're alluding to, Tony, around some of these services need to be part of our preferred future. That is a model of working in an integrated way, as are lots of the work that we've done around infection control and other sorts of supports to these, to closed settings like care homes, that actually are much more fit for purpose than anything we had in place pre the pandemic. So they should be long lasting in terms of that is how we should rebuild our health and care services, taking the lessons from the fantastic stuff that's happened and saying, how do we make this business as usual for us in hopefully more normal times, albeit those normal times are going to be very different to pre-pandemic anyway. I'll pause there, Paxton, because I sound like I've been on a soapbox.
You want to come in first, Clive, before I go back to Tony?
Just very, very briefly on that integrated point. Listen, I think it's been really, really important, hasn't it, throughout this pandemic. There's a couple of examples that Dave's alluded to in terms of joint working. We shouldn't be lost that we were ahead of the game going into this pandemic in terms of making a reasonably bold decision to make separate the heads of service job out in adult social care and create an integrated role, which I think has been one of the successes. I know there's a huge political will to carry on that joint working on a regional basis whenever we can. And I think now that within the health board, certainly with the previous chief executive and with the new chief executive, and with the political leadership within the council, there is a will to jointly build on that now strongly going forward and look at, if possible, where there's more integrated roles, consolidate the one that we've got. That would be my first priority, but build on other integrated roles going forward. There'll be a lot to review after this pandemic in terms of the contribution of the sectors per se, wasn't it? And not least looking at the terms and conditions that we're asking some of the people in adult social care to work under. But an integrated more integrated care roles, more joint working on a regional basis. We've got a really good foundation now, and I think there's an officer and political will to build on it.
Tony, do you want to come back on that?
Well, just a quick response to the chair. Thank you. I mean, for me, I think the arrangements to underpin, in effect, the private sector on the surface is a very good thing and obviously a sensible thing to do. But in the longer term, I think there's a debate to be had about the extent to which the current boundaries between the public sector and the private sector have been modified. I mean, you wouldn't, for example, I guess, want to take on a whole insurance risk for a major set of commercial enterprises that are operating at the margins, knowing that the public sector is there behind them, willing to step in and suddenly take over when disaster strikes. I mean, I don't think we want to go that far. And I think it's just interesting as to what the nature of the partnership relationship has to be, given what we've gone through, and in its various different sectors, whether it's the domiciliary care sector or the small local nursing home or residential home, and the big corporates who've got their, you've heard me say this before, their profits in tax havens overseas. But the other thing, just coming back to the work between health and social care in terms of post-COVID, I mean, I would hope that I'm sure it will be, in the arrangements that we make, that the support will be as much to recognise the work of the staff as it will be to heal and to soothe.
Thank you, Tony. I think one of the things I would say is that it's an ill wind that blows nobody any good. And hopefully one of the things that does come out of this pandemic is this much closer working together of health and the council. I know we've talked about it for years, but if this brings it about, then that's got to be a positive plus. Do you want to go on, David, or are you happy with where we are at this point in time? I think looking at the time.
I'll go through. I'll go through a couple of the other things that you raised as a panel, just to touch on them and give you you asked the question around testing and the effectiveness of testing. I suppose the point I'd make in relation to testing is there's a much lower level of take-up of testing in our region at the moment, and some of that may well reflect the lower infection rates. But I suppose I have a slight worry about well, is the low rate of testing uptake in our communities giving an artificial impression of what our actual rates are? It's always, there's always more infection than actually comes through in the numbers, but we do have a surprisingly low level of testing take up in communities at the moment. The turnaround times, which you'd raised as a concern previously, I don't have concerns around turnaround time at the moment, certainly for our critical areas like care homes and the whole home testing and the testing of staff that takes place. I suppose the next challenge is going to be the rollout of lateral flow tests. So these tests that you can effectively self-administer, gives you a result within half an hour, and how we're going to use that, how we're going to use those tests as an added infection control measure in some of our critical services. There's a bit of a dilemma, certainly for me, about how much we can keep implementing new things all at the same time. So my priority at the moment is the rollout of the vaccination programme. I think probably the timing of any serious rollout of lateral flow testing, I think comes slightly, get a bit further into the vaccination programme before we invest too much energy in that. Partly just because you can't do everything at the same time is my it would be my view about some of that. There tends to be an expectation, well, these things are available, therefore we can do everything all at once, and it's just a bit of a risk that would overwhelm us. Now, given that our target is to get the top 4 groups of the JCVI cohorts vaccinated by middle of February, we could be looking at more seriously at lateral flow testing towards the end of February, and that would seem more logical to me. But there might be some challenge from from others around, you need to try and get everything done at the same time. I just think we have to be pragmatic about some of these things. I can see Sue's got a hand up, Paxton.
Yes, I was just going to bring her in.
Thank you, Dave. When you talk about vaccinations, I understand that all social services personnel are being vaccinated, which is tremendous because they've done a tremendous job. But I wondered where the wardens for sheltered accommodation come in that, because they're under housing. And I don't know whether it's right, but I've been told that they are not on the list for vaccinations, which I find quite amazing because they work with quite vulnerable people.
Yeah, so absolutely, there are complexities and nuances around what the JCVI priorities are. So it's not, JCVI priorities aren't that all social services staff get vaccinated. The JCVI priority is that all frontline social care staff delivering care that can't be done from a social distance are the priority group that JCVI expects us to vaccinate. That's the same rule for health staff as well. The truth is, Sue, there is, it's never quite straightforward to work out, well, exactly, do you exactly fit that priority or not? There would be a concern about if we're going to hit the target for the top 4 JCVI priorities. There's only pretty much what we know is that there is enough vaccine expected to be in this region to be able to prioritise those top 4 groups, as long as we make sure we're vaccinating the top 4 groups as they were intended by the JCVI. As soon as we move away from that, and and there's plenty of examples like the wardens that you've mentioned that you think, well, are they in the category or not? And loads of people keep asking us, well, we must be in the priority because we do this stuff. If the health board essentially relax that definition too far, we just wouldn't get all of those priority groups done. We wouldn't get the clinically vulnerable, we wouldn't get the 70-year-olds, we wouldn't get so it feels difficult. I suppose the bit to hang on to is the vaccination programme overall includes everyone. So it's not that those people won't get a vaccine, it's about the quickness of when they'll get a vaccine.
Yes,
so
yes.
They wouldn't get it before, by the middle of February, for example, but that doesn't mean that they wouldn't get it by April,
Right.
but that's probably the way to view it.
But when I hear that office staff have had it in social services and who are maybe working from home,
and I can't say to you, Sue, that there won't have been errors, somewhere along the way. So if I give you an example, for social care, we had to contact 500 organisations, as well as all the teams, within the councils across the area, as well as all the.
I appreciate it's a huge job. Yeah.
So that the truth is, we try to spot mistakes, but it was such a massive logistical exercise that there will definitely have been. Will have been.
I do appreciate that. I do appreciate all the work, but I'm just highlighting the fact.
Yeah, no, absolutely.
Yeah.
Not by design, though, Sue. So it's not. Everybody gets it based on.
And I'm not criticising.
Yeah.
I just want
to.
No,
and I know that, Sue.
Yeah.
I'd be disingenuous though if I said, as some people ended up slipping through that actually didn't fit the priority. Yeah, they will have. That but it'll be very small numbers of people that will have slipped through, and we keep going back to check, to make sure. Hang on a minute, have we got the right groups?
Okay.
To make sure we hit the target.
Thank you.
Okay. Do you want to go on from there, David, or are you happy with what you said now? Are you covered?
Only you did ask some questions about children's services. Again, all very good questions. Just generally to say, yeah, you've picked up on all the right areas. We are worried about, or were worried about assessment performance. Cabinet members already commented on, really pleased with the improvement. I think the general view is, yeah, we've seen some improvement. We've seen some improvement for a couple of months. The workforce situation remains fragile. In children's services, probably the biggest impact is schools being closed, and we have a relatively, young cohort of staff. So they're juggling, caring for children predominantly, at the same time, and that does have an impact on performance. So we're not absolutely sure at this stage. Will we see a further dip? We might, but there are measures in place to try and limit and mitigate that. You asked some questions around direct work performance and in the monitoring of direct work performance. Well, I think that we are implementing WCCIS, the National Healthcare Information System. We've kind of parked any system improvement in Paris, which is our current system. So there are some flaws in the Paris system, which is what's giving rise to what looks like poor performance. We've amended it in WCCIS, and you might think it's a bit ridiculous that we're doing this, but we're still planning to implement WCCS to the timescale we set. So implementation of WCCS is still planned for next month, which does add a challenge. But the reason we're pressing ahead is because we think we can do it despite the challenges, and because it's going to have such a benefit on supporting performance improvement as we recover from COVID. So it'll take us a couple of months to see the benefits, probably more than a couple of months, and you actually might see some reporting difficulties during, post implementation, but the pain is worth it from my perspective. So we are pressing ahead with that. And I hope to report positively on that the next time we have a meeting. You asked quite rightly about the youth justice system. Biggest concern, we had lots of concerns, obviously, about the youth justice arrangements following that, following the poor inspection, and the youth justice system service, has been, youth offending service has been impacted by COVID as well. We're now seeing significant improvement around performance in relation to the timeliness of assessments. Done some really good work around supervision arrangements of staff, upskilling staff, etc. All the policies are in place, that were missing when the inspectors criticised us last time. So despite COVID, we are on track, for all of the improvement expectations that the inspector has set for us. Clearly there will be performance impacts of COVID that we'll need to explain. But you asked the question, are we confident that we're on the right track? And I am confident that we're on the right, on the right track. And then the question, rightly again, how are we doing in terms of supervision across children's services? We are having blips in some teams. That's generally associated with, again, the staff responsible for supervision, being off and isolating themselves. Then we have a dip in performance as a result. What we've also experienced is we're not sure in some of the teams that we've got the right balance between the level of, support around staff well-being, which is a part of supervision, and then the kind of supervision of, performance and practice, etc. So Julie, our new head of service, is just revisiting that for some of the teams, because there does have to, at the moment, need to be a greater emphasis on, staff well-being stuff, and we just need to work out how we're reporting the two elements. So that'll prompt a change in the reporting. But all of the areas that you've picked up on, just to give assurance, head of service picked up on that, the cabinet members picked up on that, and measures are in place to do the best that we can to mitigate any deterioration. And I'll stop there, Paxton, because I'm really rambling on.
I'm just going to pick up one point, if I may, on that. I think you said earlier that there has been an increase, albeit a small increase, I think you said, in terms of the number of children on the risk register. Are you expecting that you're going to see another increase once the schools start going back again? And also, how closely is that tied in with domestic violence? Because it's certainly something that we are looking at to cover in the next few months sometime in terms of scrutiny, because that was something that was agreed in the programme, I think, some time back. So I'm just wondering whether those questions are tied up together and how much of a concern do you have on that?
Yeah, look, you're picking up on all the issues that we're having to monitor, Paxton. The first time schools went back, we didn't have a massive increase in activity in at our front door. We had some, but we didn't have a massive increase. Actually, in terms of the rates of safeguarding child protection referrals, the arrangements that are in place now, whilst schools are off, are proving pretty robust. So our levels of activity, particularly around referrals of the most serious concerns, are at the level that we would expect them to be. We could clearly see, a further increase for all sorts of reasons. Not least the impact of COVID in the way that we're describing anyway, that impact on, family circumstances, stresses. It's had an impact in terms of substance and alcohol use, has had an impact on domestic violence, as you said, worried about increases on, mental health difficulties for all members of the community, including parents, children, young people. We are worried about, continue to be worried about the kind of exploitation issues linked to county lines and things like that you've talked about and explored previously. So yes, we do think all of those things have had an impact or may have a further impact. I think what the head of service fed back to us in PNFM is actually at the moment, with partly what we think is going on is our ability to work with families, particularly around things like issues of long-standing neglect, etc., are limited because of the limits on our ability to work with people. So there's something about probably the effectiveness of some of our interventions being compromised. Therefore, children's names are staying on the child protection register longer. And then if you add in, the rates at which we're picking up on new concerns, that's coming together and leading to an increased number at any given time. Now, we haven't got solutions to all of that yet. As Cabinet Member said, Julie and her team are doing some more work on some kind of deep diving on, where have we got examples where things are working well? Can we do more of that? Do we have a proper understanding of, how that cohort's needs have changed? Are we amending our service offers to address these new challenges, etc.? I think it's probably too early to say. It's not a massive increase. Usually I would expect the range of, children subject to a child protection plan for Swansea to be between 220 and 260. And at the moment, it's at 280. If it was at 340, I'd probably be alarmed. And if we see, those numbers increasing, month on month and then heading towards that sort of level, then, we'd be looking for, goodness me, we've got something that isn't working quickly enough to adapt our services to be good enough for our children's population in Swansea. It's not quite like that. I think it's really good that both the Cabinet Member and the Head of Service have picked it up early doors and said, look, it might only be a bit above the rate that we would expect, but we don't want to, we don't want to see a trend developing. And then all the things that you've described, Paxton, of what about when the schools go back? What about when the impact of, the difficulties that families have been experiencing for such a, long period of time play through? You could see it quickly accelerating. So it's being a bit proactive at this stage. I think what is a bit, what is encouraging for me is that our, our looked after children numbers, which is obviously a focus for us in our lack reduction strategy, which we're not parked that during COVID. If anything, it's even more important to us. We are seeing some decrease in those numbers, albeit it's fragile. And Julie was certainly alerting us at the beginning of the week to it was a difficult week last week. You know, she's anticipating that numbers might increase again for a short period, albeit overall our numbers are still down. And if you look at most authorities across Wales during COVID, their numbers have increased, whereas in Swansea and across the region, you know, our mature looked after, you know, lack reduction strategies do seem to have had a really positive impact, which is good. You know, we wouldn't want to lose that. Yeah, I'll stop there, Paxton.
Okay, David, thank you. Anybody got any further questions for David before I call in Elliot or Clive if they want to speak and sum up on that? Anybody? Sue?
Yes, just a comment really for the recovery of both staff in health and social services for all the work that they've done. I'm sure we're going to have a need for far more support for the staff in the future, and I think maybe that should be put on our work programme. Paxton?
Okay, Sue?
Yeah.
Clive or Elliot want to say anything?
No, just thank the committee. Thank you, Chair, for allowing us to give the update. I'd echo what Sue was said. Really, I think that is a really good point. Isn't it? Again, you know, you can't help but be absolutely blown away by what has been achieved through our workforce in the council and in health. It's not only that they've responded and to our most vulnerable residents. At the same time, you know, if Amy and Helen was here, they would want me to explain that they're providing solutions as well. It's not just about carrying out their normal day-to-day work and, as I say, responding to our most vulnerable. They have provided many of the alternatives, the alternative ways of resourcing, of making bringing more resilience into the organisation at a time when we're already asking too much of them. So, you know, I can't help but you know, words. You know, there's not enough words to describe how our workforce has responded. But yeah, we're going to have to deal with the ongoing sort of well-being of the workforce, and so any work that Scrutiny can undertake to assist us in that will be wholly welcome. But yeah, absolutely amazing.
Okay, thank you, Clive. If there's nothing else, then I will bring this meeting to a close. But before I do, I think I have to say that you have made perfectly clear the pressures on staff and the work that's being carried out. I know we said it at the last meeting, but there's absolutely no reason why I shouldn't say it again. But we do certainly owe them, as people of Swansea and ourselves, a huge debt of gratitude for the work that's been done. I'm sure I talk on behalf of everybody on this committee when I say that, all councillors in fact, and I would hope that you would pass on our deep appreciation of all the huge efforts that have been made back to our staff every time you have the opportunity to do so. Thank you very much.
Thank you, Chair. Stay well, everyone.
Yeah, thanks everyone.
Thank you, everybody.
Thank you all.